Globally, where are the cases surging the most?
So we are seeing cases are surging the most in the developing world, nations ranging from Laos to Thailand in Southeast Asia, and those bordering India, such as Bhutan and Nepal. And we also have some Pacific Islands nations that are reporting the first waves of their COVID because they largely escaped the pandemic last year. So it's looking quite worrying that a lot of these places are less equipped to actually cope with the virus, and they are lacking the resources, and many of them are facing variants that are more transmissible. So this is a situation that, WHO officials said, it's not just India. It could happen to any country if we don't take good care of it.
And of course, we've all seen the stories about people having to walk for hours looking for oxygen tanks, for days to look for available hospital beds. So what are we seeing here when it comes to the sheer pressure on healthcare and medical systems?
In Laos, for example, the health minister last week sought medical equipment and supplies and treatment, including asking help from Vietnam. And cases there has jumped more than 200-fold in a month. And Nepal is seeing hospitals quickly filling up and running out of oxygen supplies, just like what we are seeing in India. And also, Thailand has health facilities running under pressure, and the government is setting up field facilities. So right now, it's really important that developed countries can really reach out and share the resources that they have to some global initiatives, including sharing the vaccines on hand if the supplies is already over the demand.
Yeah, so what are the channels out there? You mentioned global programs. Perhaps you're thinking of COVAX. We know that Moderna has been supplying now 500 million doses of their shot. What else can the developed world really do?
Yeah, so COVAX is definitely one example, and there are a lot of the bilateral helps, for example, between Laos and Vietnam. And these developing countries, although their population and size of outbreak is still very far from India's, it's important to also pay attention to them, because just oftentimes we go to the biggest outbreak and we ignore the surges here, because a lot of them, for example, Laos, it's the surge is so much larger than India, and it's just important to pay attention to what place could be the next outbreak.